The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Good afternoon, everyone. My name is Dr. Charlene Ortiz, and today we are going to talk about a new topic. Today, we're going to talk about surveys and correlations, but primarily today, we're going to focus on the survey side of things. Now, surveys are immensely important in the field of mental health or counseling or social sciences in general, because surveys allow us to get some sort of understanding of the inner workings, personality, perceptions, mental illness, characteristics, and traits of the individuals that we are researching or the individuals we are trying to treat. So this topic is for you who is interested in doing assessments later on, or even developing your own research tool or your own assessment instrument. So notice that if you're one of those people, you'll find this topic interesting. And even if you're not one of those people that wants to develop an assessment tool later on, you're going to get an understanding of what are the mechanics and what are the aspects of an assessment. Therefore, whenever you do apply these type of instruments with your own clients or patients, you'll see where that came from. So let's get started. All right. Good deal. So let's talk about survey research designs. Notice that we have previously talked about experiments. We have talked about quasi-experimental approaches, but we also have the survey approach as a research design, right? So we do have it available. Why is it beneficial? Well, in order to use a survey, right? We can do it either in a written form, we can do it orally, we can also use it to quantify and describe the characteristics of both an individual or a group. So because we have the ability of gathering so much data, we also have the ability of gathering data from both individuals and a group. So it does give us a really good understanding of the information that we're trying to gather from these individuals. Now, I need you to remember that a survey is non-experimental, right? It is a non-experimental approach. If it's non-experimental, means it doesn't determine cause and effect, right? So I need you to remember that, because some practitioners, right, that would administer a survey, say, for example, in research, and say, oh, I found the cause of my dependent variable, right? I found the cause for that mental illness. Well, notice that it's non-experimental, okay? So what we're trying to do is establish, if you go back to our slides, you'll notice that what we're trying to do with survey research is basically ask questions, right? We are asking a series of questions. We're going to prompt this individual with a certain type of statement. And generally, these statements we are going to refer to as items, right? So you probably have heard me before referring to an assessment and its elements, oh, the items of. Well, that's why, because the formal term for these questions and these statements are items. We try to use them both in a questionnaire or an interview to measure self-report. For example, when we are doing the questionnaire, we can think about that they are self-reported. But when we're thinking about an interview, I want you to think about the responses, right? That's a really good understanding, right? Good way to see both. I want you to also remember that it is called a questionnaire or self-report because it will include questions in which that person, that participant, is going to report and talk about themselves, right? And they can talk about anything. They can talk about their attitudes. They can talk about their beliefs. They can talk about their viewpoints. They can talk about symptoms. But notice that they are self-reported, right? They are self-reported, right? So it's not coming from a secondary source or historical data. It's coming from that person. So any questions about a survey? And also my people watching live online. All right, let's go back to our slides. Now, when it comes to the type of survey items, we have many ways in which we can create our items, right? We have different types. We have open-ended items, partially open-ended items, and then we have restricted items. I've heard the term restricted. I've also heard it being referred to as objective, right? So if you see, for example, we go back to our slides, sometimes you can see open-ended as subjective, and then sometimes persons refer to restricted items as objective, right? So you may see that, right? I think that's more of a dated and archaic term, but it wouldn't surprise me if you guys saw it again. So that's why I am bringing it up. So let's talk about a little bit more in detail, right, of these types of items. So let's talk about those open-ended items. An open-ended item is the ability, right, to respond to a question with your own words, right? You're not going to have any sort of restriction, right? So think about a therapeutic session, right? I know a therapeutic session is not a survey, but think about, for those of you who have been in therapy or have heard about therapy, you notice that therapists tend to ask open-ended questions, right? Why is that? Because we want to learn about your subjective experience, right? So for example, if you're going through a divorce, right, that's your experience, right? So if I were to be a person who's divorcing, sure, there's some sort of being related to that situation, but I always want to hear your subjective experience, right? That's why we utilize open-ended questions. In keeping with that, notice that open-ended questions are generally utilized most often with qualitative research, right? Can anybody tell me about qualitative research? What is qualitative, right? What does it sound like? Yes, ma'am.
It involves numbers or values.
So that would be quantitative, right?
So qualitative is what involves qualities.
Correct. So Dr. Kate over here is mentioning that a qualitative research involves qualities, right? It sounds like it. It's characteristics, right? So when I don't know much about a topic, generally we refer to the qualitative research, right? So for example, we don't know much about depression and COVID, right? Because it's new. So generally, if we were to conduct a survey, if we were to conduct research in a topic that is not as known, notice that I will refer to qualitative research. I want to hear about your experience, right? I don't want to restrict that experience, right, with very restricted items. Now, when you are conducting qualitative research, you beforehand should anticipate and list all of the possible responses, right? All of the possible examples in terms of how do you think that person is going to respond, right? Either write them or express them. But you, as the researcher, if you're conducting a qualitative survey, right? Open-ended questions, you have to foresee and have a general idea of what the answers are going to be. So let's go back to that example of COVID. We could expect that a lot of those answers may deal with isolation, right? We could expect that a lot of those answers can deal with death, right? Because of the mortality rate of COVID. So notice that I, as a researcher, before I even ask the first person about depression and COVID, I must have a list of possible answers. Why is that? Because we will need to code them, right? We will need to code those responses, right? We need to code those responses, right? So think about, I would have, okay, so we have our depression and COVID survey, and we're going to have the little category or the little box of isolation. We're going to have the little box of death. We have the little box of, say, surviving something really difficult, right? So for example, a loved one didn't die, but they survived it, or maybe the actual person who is answering the survey. So notice that beforehand, before I even talk to the first person, I already had these little categories so that it's easier for me to code your response. So when I ask you the question, how do you feel about depression and COVID? The person may start talking about, oh, so my mom died, right? So he is coded in this category. And then another person says, well, I had to be put in a ventilator. That was very traumatic. It was a very difficult experience. Okay, so then you're gonna put this response in the serious illness category, right? So if you notice beforehand, it makes it much easier if you just code the responses. Now, every now and then you're gonna get a response that doesn't fit any coding, right? But if you did your job correctly, most of the answers will fall in those predicted categories. So any questions about that? Good deal, good deal. Now, another thing we could do with this type of open-ended item is that we may be able to use multiple individuals, right, multiple raters, in order to understand if my coding is accurate, right? So I don't want to randomly create my coding system. I want to be able to both relate it to another person. So for example, if I am creating these categories, right, this code for depression and COVID, I may want to reference another person that, for instance, is known and is an expert or has some foundation with depression. Right? So here is an example of an open-ended question. Let's erase this here so it doesn't look as menacing with all that red, am I right? So here's an example. What are your views on the role of patients teaching medical students? Right? So notice it's not giving you a negative or positive. It's not trying to lean your response in any specific way, right? So the language is pretty neutral. So notice that this would be a good example of an open-ended question, of an open-ended item. Any questions about open-ended items, coding, or the example illustrated in your slide? Yes, ma'am.
Can you do an example of coding?
So for instance, when you do coding, what will happen is we're going to create these categories, right? And sometimes what's going to happen, you can do inter-rater analysis. So it's very similar to what we saw in the previous lecture, that we're going to compare one item with the other and see how much they relate. So it's very similar to that, right?
Sort of like categories?
I'm sorry?
Sort of like categories?
Right. So it's going to rate your categories based on, okay, are these items related to one another? So it's very similar to what we did last week, our last lecture.
Oh, okay.
Right, so it's really simple. It's going to compare the categories and see, for example, if I have a questionnaire about depression and I say, item 1 is I'm very lonely, item 2 is I cry all the time, so item 3 is I like squirrels. When you run your statistical analysis, similar to coding, it's going to say, okay, this category that you created is probably not the best category.
That makes sense. Thank you.
Any questions from my people watching online? All right, let's go back to our slide. Let's talk about, we're going to move first to the restricted. Right? Let's move to the restricted items. So when we're talking about a restricted item, we're literally doing the complete opposite, right? I don't want a very open statement. I don't want to find that general opinion, right? That general expression of your values, beliefs, symptoms, characteristics, life experiences. Here, we're going to have a restricted number of answers, right? So we're going to have restricted opinions, and you're going to have to respond to that restricted item. Now, generally, the way these items look like is with and there's a huge debate as to how to pronounce this. Some people say Likert scale, some people say Likert scale. I usually say Likert. I usually switch between both. But nonetheless, a Likert scale is one that is numeric, right? Basically in a scale form. And what we're going to do with this number is that the participant is going to rate their response, right? A level of agreement. What does that mean in the Queen's English, right? What does it mean in plain old English? Well, say we have our Likert scale. Generally, usually it's 5 items, right? I've seen it with 3, I've seen it with 5, with 7, with 9. So, of course, the more in the scale, the more specific that answer is going to be. So think about any survey you've ever conducted, and it will say something like, I really like the cheeseburgers in this one place, right? I strongly agree, somewhat agree, I am neutral about those burgers, I somewhat disagree, and I completely disagree, right? So notice that it's going to ask you about your opinion. It's not asking you why you like or you don't like the burgers. That will be an open-ended question, wouldn't it, right? That's a better question for an open-ended item. Why do you prefer so-and-so burgers? Or actually, that's a bad example because it's leading, as in preferring, right? So that would be a bad example. What's your opinion about so-and-so burgers? That's a better open-ended example. So I'm trying to restrict your responses with the Likert scale. Now, remember that the Likert scale is the most common method. It is the most common method to ask for information. The thing about Likert scale, we do have some advantages. Right, we do have some advantages. And here, we would see that we can easily enter, right? We can easily conduct a statistical analysis with the Likert scale because it's already numeric, right? It's already numeric. So for instance, I can have this example here. I have nightmares, right? So for example, I can give this a value of 1, can give this a value of 2, I can give this a value of 3. And I can later conduct statistical analysis relatively easy because it's already numeric, right? It's already numeric. Whereas with open-ended questions, that's a little bit difficult because now I have to identify themes. What was the theme that kept coming up? So in my example of COVID, say the theme that kept coming up was death, or the theme that kept coming up, say losing my job, right, because of COVID. So that theme came up. That's a little bit harder, right, to conduct analysis with, right? There's a lot of interpretation that goes on in that process. Whereas with the Likert scale, it's a little bit easier, right? Because we already have that numeric value. Now, one of the disadvantages, right? One of the disadvantages of the restricted items is that I am giving you the response, right? I am giving you the response to the item. So when I say, for instance, in the example of the burgers, or I can give you another example, when I see crying children, it makes me upset, right? When I see crying children, it makes me upset, right? So we start talking a little bit more about empathy, right? That's what we're talking about, right? When I see a child crying, it makes me upset. The problem is that I am already giving you the answer. So I'm saying, you agree, you don't agree. So I'm giving you the opinion. You agree or don't agree, or somewhat agree, right? So that's a problem because there might be some nuance to that. Maybe you have a baby brother you can't stand, right? Had it been an open-ended question, I would know that, but it's not. So I'm restricting the amount of responses that you can give me. So any questions about that? Any questions about that? Good deal. Let's go back to our slides. Now we know about open-ended, we know about restricted. Let's look at a combination of both. This is actually pretty similar of what a therapeutic session would look like, quite frankly, because sometimes you want to lead the client into a specific answer, or maybe you just want the more subjective experience. That's when partially open-ended items come into play. In the same assessment, we may find that we both have restricted answers. And then we have perhaps another one that allows the participant to respond with their own words. So notice that one was restricted, right? One, I am giving you the answer for. Whereas for the second one, now you have the ability of explaining. So let's keep in with that example. When I see crying children, it makes me upset. Strongly agree, somewhat agree, neutral about the stand, somewhat disagree, completely disagree. That would be a restricted item. And then that could be followed up with, let's say, what is your opinion about crying children? That's open-ended. Now I can gather more subjective experience. Now I know how you feel, hopefully. Because remember, it's self-reported. And we always want to show our best side, don't we? So it's self-reported, right? You don't want to sound like, oh man, I don't like crying kids, right? So it's self-reported. But notice that at least I have somewhat of an understanding of your viewpoint with that item, right? How do you feel about that response, right? About that item. Any questions about that? Good deal. So I've actually brought an example, right, for you guys. It's a real example. And these are close, right? They are restricted items. And this is for psychopathy, right? So this is an assessment that we give individuals for psychopathy. And I'm going to pass it along so that you guys can see it. And I do want to remind you that this is for educational purposes only. I am not trying to diagnose you, and hopefully you're not trying to diagnose yourself, right? So this is so that you have an example of what closed-ended items look like. Specifically, in this particular case, is for psychopathy, right? So this is a very commonly used instrument. So I'm just going to pass it along, and we can start around here, and then it just makes its way around. Here you go, right? So that's a really common forensic assessment, right? It's a forensic assessment that we use to test for psychopathy in individuals. So it's interested in personality traits. And remember, when we are doing a survey, we are trying to survey, right, and understand characteristics or traits of a person or people. So hopefully that would serve as a really good example of a real assessment for you guys. Let's go back to our slides. Now, when we're thinking about a survey, you notice that earlier I gave you guys an example about a survey question, but then I said that's probably not the best question. And why is that? Well, because we have to meet certain criteria, right? We have to meet certain criteria to ensure that there is the least level of bias, right? That this item will reflect your opinion and your opinion only, not my opinion, not a visceral opinion, not an emotional opinion, a misled opinion. Notice that it's my responsibility as the survey creator to enforce that my items meet these characteristics. And this is immensely important because you want to ensure that you're getting the best data that you can possibly gather from this individual. So let's look at some of these some of these rules, right? Some of these rules that we should use in order to create survey items. But firstly, who can tell me, keeping it simple, what type of language should you use? Should you use, say, for instance, when you're writing your items, should you use high school language? Should you use entry level college? Should you use graduate school level language, right? Elementary school language? What do you guys think? What's generally the average, right? And we're talking about a healthy population, right? So you're trying to survey a healthy population, right? Or general population, let's say that. How many of you guys think that in keeping it simple, you should use high school level language? Much lower. Okay, so we have, okay. What about like entry undergrad college level language in your survey? Right, kind of like how you guys write right now, basically. Okay, what about more sophisticated language? So we're talking about like graduate school language. How many of you think, okay, that's how the survey should look like? All right, so generally we want to write in a high school level. Right? Generally want to write in a high school level. There's many reasons for that. But first of all, not everybody has the same level of education. Right? So that's one of the main reasons. And also, I need you to think about the level of distress. Think about the level of distress that this person is experiencing when answering a survey, when answering an interview. So for instance, if I'm asking this person about psychopathology, right, about their depression, hallucinations, I'm already putting this person in an uncomfortable spot. Right? So I need to keep it simple because we're already experiencing a level of distress. Notice that mental health does not come without risk. There is risk for treatment, one of them being cost distress. So it is high school. Now, we also don't want to go back to our slides, we also don't want to miscategorize those response items. And what do I mean by that? We should try to not create too many or too few categories, right? You don't want to create too many categories for your assessment. You also don't want to include too little, right? As a rule, you should try to limit your responses to no more than 9 categories. That's generally the sweet spot, right? Generally 9 categories. We also would like to revise whether or not you're using an interval. If we go back to our slide, let's make sure that we are utilizing an interval or ratio data, because generally this is more informative, right? If you remember from previously, we have nominal, ordinal, interval, and ratio. You know that generally the most informative scale is ratio scale followed by interval. So generally, if you develop your survey items in this fashion that utilize interval and ratio, you'll see that your responses will be more informative. Now, in keeping with issues that we may have, is we want to avoid double barrel items. We want to avoid double barrel items. And what is that? That is that I'm asking you 2 questions at the same time. I'm asking you 2 questions, right, in the same item. We want to avoid that. So say, for instance, I say, tell me about your experience while attending therapy and what did you think about your therapist? Those are 2 different questions. They are not one item, those are 2 separate items. What is your experience? Maybe you enjoy this experience, but then the personality that your therapist had, you know, he helped me a lot or she helped me a lot, but you know, I just didn't like the guy for whatever reason, right? Maybe he acted a little wonky. What? Therapists act what? Therapists need therapists? What? So you want to avoid that kind of question, right? Asking two questions in one item. And also, we want to avoid biased language. And notice that earlier when I was giving you an example, actually reverted and corrected. I said, why do you prefer so-and-so burger? That is biased language because I'm already leading you into thinking you prefer this burger, right? And we want to avoid that. That's why I regress and say, okay, that is not a good idea because I am leading you into preferring. How bad was being in a car accident? That's also biased. How bad was it? I'm leaning your answer towards the negative. How much do you hate confrontation? Right. Again, that sounds immensely biased. Maybe you love confrontation, right? Maybe you love it. I love using confrontation in sessions, but your understanding of confrontation in a regular setting is a little different than it would be in therapy, right? So it's actually a therapeutic technique to use confrontation. Confrontation in therapy meaning find thoughts, emotions, and behavior that will match one another. I want to lose weight, but I just went grocery shopping and didn't get one vegetable. One doesn't match the other, right? So we confront that. Want to lose weight, but your behavior, that's your thought, want to lose weight, but you didn't buy one green thing of the month to do, right? So we confront. In therapy, we would do that. Now, similarly, we would want to avoid negative words, right? So you see that a lot in surveys that are political in nature. So you would see something like, I hate this political group, right? Or I hate people that identify with XYZ party. Okay, well, maybe you didn't hate them, maybe you dislike them, and that's still negative. So a better question would be, what's your opinion about so-and-so party? That would be a better item because it's not leading towards that negative, right? It's not leading me towards that negative concession. Now, another issue that we may encounter is we're trying to ensure that we are avoiding a response set pitfall. That's a very complicated term to say, my examinee, my respondent is kind of figuring out the answers, right? Person is kind of figuring out what they should answer, right? So for instance, all of your items would say something like, I like so-and-so burgers. I enjoy so-and-so fries. I buy these nachos all the time. Notice that all of these responses are in the positive, right? So it's either like strongly agree or strongly disagree. So what you would like to do is something that we call a reverse item, right? What is a reverse item? It's simply that every so often, and there's a statistical procedure for that, to find out how random you're going to set this reverse item, is that you're going to use that item, but you're going to word it differently. You're going to reverse it. For example, we have, I like so-and-so burgers. You can say something like, I don't like so-and-so burgers, right? So now you're using a reverse item. Or you can say something like, I dislike so-and-so burgers, but then in the next item, or further along the assessment, you can say, so-and-so burgers are my favorite. So if you see one, if you really like them, it would say the response is strongly agree or disagree. But whenever we're actually calculating that response, the items are reversed, right? So saying I strongly disagree means that you really like those burgers, right? So it's the opposite set of answers. So if I say, I don't like so-and-so burgers, like, no, I strongly disagree with that. I love those burgers. So notice that the idea with the scale was reverted. You also want to make sure that you are indeed using those rating scales consistently, I should say. Want to make sure that you're using them consistently. And what you want to use, right, is that you don't want to change the answers, right? So if you're using in your assessment, strongly agree, somewhat disagree, neutral, somewhat, right? You don't want to change it later on and say all the time, sometimes, not at all. That can confuse the examinee. That can confuse the respondent, right? We went from one scale to another. We went from strongly agree and strongly disagree to all the time or never, right? Those are two separate scales. And they can set up the person for failing. You also want to limit the points, right? You want to limit the amount of points on that scale. So there's multiple scales, right? You can use a response that has a midpoint. So like I mentioned, the neutral in the middle. There are exceptions to that though, right? So we will have the strongly agree, somewhat, neutral, somewhat, and disagree. But we can also have bipolar scales. Right? And no, we're not talking about your friend, right? We're not talking about your ex, right? We're not talking about somebody in your family when I refer to bipolar, right? Not referring to me, right? We are referring to a scale that's basically yes or no. It's dichotomous, it's bipolar, right? So there's polar opposites. Whereas with other scales, there seems to be more nuance to it. I somewhat agree with that. I somewhat disagree with that. Now, we also, whenever we are developing our items for that assessment, for that survey, you want to ensure that labeling. Right, we want to ensure that labeling. What do I mean by an anchor? Right, what do I mean by an anchor? Basically, it's an adjective. An adjective that I'm going to put at the end points of that scale. So an adjective that I'm going to put at the end. You want to be consistent. And the last point is I want to minimize how many items I have. Minimize how many items you have. How many of you have heard about the MMPI before? Right? So the MMPI is an immensely long assessment tool. It has, I think, 500 and let's say 540. How would you feel answering 540 questions? That is a whole lot, right? However, it's an immensely useful tool. It leads us to know things about personality, potential mental illnesses, traits. So it's immensely useful, but notice that it is so long, right? There could be so many things that could affect that respondent, one of them being the length of the survey. So if it's really long, you're going to zone out before you respond. And actually in the assessment that I just showed you guys for psychopathy, how many items does that have?
154.
154 questions. So that's pretty short. That's pretty average, right? Funny because we will give this to someone who we suspect has little empathy. Now they're going to say, hang out with me for 154 questions, right? So you do want to limit it because persons can get fatigued, persons can get confused, persons can try to predict what you're trying to assess and therefore start skewing the answer. So I'll show you that I'm not psychopathic, or I'll show you I'm super depressed, right? So there's so many things that could happen simply because of the length of your survey. So any questions about that? Yes, ma'am.
Do they ever give any kind of breaks when they do assessments that long?
Generally not. Generally not. So the question was, do we get breaks? The answer is no, generally, right? Why do you think, if I were to give you this assessment, why do you think there's not a break there? Who can give me a wild guess? Yes, ma'am.
Because you might get biased information in the break.
You could, right? For example, you go down to the bathroom, it's like, yo, what are you doing? Oh, I'm doing this one thing. What? You must be crazy, right? But things like that. You can get biased information. We want to keep it standardized is the correct answer. We want to keep it standardized. We don't want bias to come in, like Dr. Kate mentioned. We don't want bias. We don't want another factor coming in because this assessment tool has already been standardized, right? Meaning that we understand statistically how much we're going to apply this to the population. So we don't want it to be biased. I have seen, however, people giving breaks between assessments, right? So say the person's taking the MMPI, you have a break, then you take the PPIR, have a break, you take the PAI, have a break. Right? So I've seen that. That does happen. Does that answer your question?
Yeah.
Okay. Any more questions? Something that one of my professors taught me a long time ago is you should always do the assessments that you're trying to administer. You should always try to do them yourself. It's going to show you about fatigue. First of all, don't diagnose yourself, right? But it's going to show you about fatigue. It's going to show you difficult items. It's going to show you the reverse items, right? So it's really, really beneficial to do assessments yourself, right? Do assessments yourself. Right. Now, there is multiple methods through which we can administer a survey. Well, first of all, we can do written surveys, right? Written surveys. Now, this involves a physical, right? It involves a physical interaction, right? We can do that in many ways. We can send them through regular mail. We can do it in person. We can do it via the internet. See, there are benefits and limitations for each, right? There's benefits and limitations for each. Let's talk about written surveys in regards to mail surveys. The limitation with mail surveys is that it is more likely, right? It is more likely that the person is going to choose not to complete it, right? Going to choose, well, I'm just gonna throw this in the trash, put it in the shredder. More likely that that will happen. I'm sure some of you might have received a survey in the mail and the first thing you do is throw it into recycling. I recycle, I'm super green. Don't throw stuff away, right? So I recycle that, right? Most of us will throw it away. Now, there is a benefit to it, however, with mail surveys. There is a benefit, which is it will require less of your time as a researcher, right? Because in a classroom, maybe I only have 100 people. Maybe I can read 100 surveys. What if I'm surveying 1,000 people, right? What about if I'm surveying a whole county, right? What's your opinion in the water system and the electric power XYZ county, right? That's a couple hundreds, if not thousands of people, right? So if we do a mail survey, it's less, sure, it takes less of your time, but it does have a high rate that people just simply choose not to complete it. Now, how do we minimize that issue, right? How do we minimize that issue? Well, generally, most people, when they send out a mail survey, it's going to include a return envelope, right? So it's already going to have that postage, right? So it's already paid for. The person doesn't have to get stamps. It's already paid for. Let the respondents know in advance, right? They're expecting the survey to come by. It just doesn't magically appear. Generally, it's also very important to include a cover letter, not only because they'll understand the research, but they'll know what the information is going to use for. So we're falling into the realm of informed consent, right? So it gives a good opportunity for the person to understand what are the risks, what are the benefits, right? And what is this going to be used for? That's basically what informed consent is. What are the benefits? What are the downfalls? And what is it going to be used for? That's what an informed consent generally answers. Also, you might want to include a gift, right? Whenever you're sending a mail survey. The thing about mail surveys, however, they tend to be one of the most expensive forms of survey, right? Because as you notice, it includes a lot of postage, it includes sending back and forth, right? Might include a gift, now you have to print more things. And the risk of the person not participating, you might be spending all this money, but it has a high rate of the person just saying, I don't care about your gift, I don't care about the postage, I'm out, right? So it is more expensive. It's one of the most expensive means to do so. Now you need to keep in mind, a lot of people don't have internet, right? So maybe a mail survey may be the only way, right, to gather potential information from a population. Now, let's talk about in-person surveys. Let's talk about in-person surveys. A good benefit of an in-person survey is that if I am there in person as the examiner or the researcher or the provider, it's more likely that people will participate. It's more likely. If I'm there in person, it's more likely that the person will participate. However, it is more time consuming. It's more time consuming. So contrary to our mail survey, I just hand it out and you do it at your own time. Whereas with in person, I am literally with you. I am asking you the questions that you could have seen in just simply that written form, right? So I just give you this, you do it at your own time. Whereas now I am sitting with a group, which would be the best case scenario, where I'm sitting one-on-one reading these questions to you, right? That is definitely, imagine having to do that 1,000 times, sitting with 1,000 people. Our best case scenario, you have a group, right? But that still will take a lot, even if we'll have a big group like 30 people, right? That's still 30 people out of 1,000, right? So that still would take a long time. Now, there is another downfall, right, that I don't see here illustrated in your slide, and that is interviewer bias. Interviewer bias, right? So interviewer bias is me, right, as the researcher, as the practitioner, as the examiner. I am introducing my own method, right? I'm introducing my own bias into the survey. So for example, if I were to ask you a question, I say, what's your opinion about so-and-so burgers? Or if I say, what's your opinion on so-and-so burgers? Right? So even something as silly as that, me changing my inflection, could guide you into saying, well, I kind of like the first one you said, but now the second one's not like, ugh. If I say I like it, it's not, I like that really greasy burger, right? What's she gonna think? So because of my inflection, I had introduced bias in your answer. I hate to say it, but appearance is also something that influences your answer when being interviewed. So for example, if I show up in my little business casual self, right? People tend to pay more attention than if I were wearing, say, for example, super casual clothes, flip-flops, right? Swim shorts, right? Looking like I'm going to the beach. It's the same questions, right? So we would think the person's going to answer the same way, but notice that because of my appearance, you may not take that survey seriously. On a random note, I saw someone on campus the other day just wearing a full body swimsuit. That's just what they were wearing for to show up to class. I'm like, live your life, girl, live it, live your life. I promise you, she was just wearing a full suit. I'm like, live your life, lady, you got it, you got it, yes. But notice, right, we laugh about it, but if she were to ask you a survey, how seriously we would take it. And we like to say, no, we treat everybody equally, but unfortunately, that's not the case. Fortunately, we don't treat everybody equally. We don't pay attention to everybody equally. Now, let's talk about internet surveys. Let's talk about internet. This is the most popular method currently to impart surveys. Not only that, it's the most cost effective. It is the cheapest way, right? It is the cheapest way to get the most data, right? It's the cheapest way to get the most data. Interestingly, when it comes to internet surveys, the problem is that not everybody has access to computers, right? Not everybody has access to internet. Not only that, they may not have the best internet, so they're not going to be able to have a lot of bandwidth and things of that nature to answer your survey, or maybe they just simply lack the dexterity, if you will, right? Lack the knowledge to work with a computer. Generally, that's why we revert to mail, regular mail services, because some people simply do not have either the tools, the means, or the knowledge to work with the internet. Now, I didn't see it mentioned in the book, but another downfall of internet surveys is that people are more likely to lie. People are more likely to lie when they're doing an internet survey. Let's say, for example, when they're doing it in person. Right, so if I send out a survey to all of you, right, it's like whatever, strongly agree, strongly disagree. Or it may be, I am anonymous, right? I'm online. She's not going to win. Just take whichever answer. Book doesn't mention it, but it is more likely that the person is going to be deceitful, whether on purpose or not knowing. Because remember, we like to show a better side. It is less likely in person. Less likely. If I ask you interview questions, now I'm like a real person. I'm not just an image online. I'm a real person. So it turns really real, right? Any questions about that? So as you notice, all of them have benefits. All of them have downfalls. And based on the type of survey that you're trying to conduct, for example, if you're trying to research a remote Native American group, right, in a very remote place, maybe the internet survey method would not be likely. Or if you're trying to study a group of college students, maybe the mail's not the best one because some of you guys drive, some of you guys are from out of state, but maybe doing it online would be the best method because of the population that I'm trying to survey. So let's look at another method, right? Let's look at another method to conduct their survey, and that is through an interview, right? That is through an interview. Now, through an interview, right? Through an interview, we have the method of doing it face-to-face. Right? We have that ability, right? We have the ability to do things face-to-face. Some of the benefits, however, is I can't control how long it's going to take you to complete the survey. I can control this. So if I'm asking you questions, right? Like the assessment tool that I just shared with you guys, you'll notice that I will have control and how am I going to guide this interview. Now, the issue with that, right? The issue with that is that because I am there in person, it's going to take, first of all, a lot of my time. And second of all, I will insert that interviewer bias. Now, whenever you become a practitioner or a researcher yourself, you will be trained in that about that instrument so you know how to sit, what to say, what not to say, as a means to make it standardized so that everybody gets the same flavor, right? Everybody gets the same survey. Now, as I mentioned, interviewer bias can be anything about me, right? As the examiner, my demeanor, the words that I use, my face, right? The old face. Basically anything that could influence you, the way that I dress, my accent, the color of my skin, your gender, right? Your gender presentation, right? Would you respond the same way to a male examiner that you would a female examiner? Right? Think about whenever you had to be surveyed about something, say for example, you're a physician. Did you feel comfortable that you had to answer that question with a male physician, or would have been different if you had a female physician? So we like to think we don't have bias, but I'm pretty sure that at some point you might have preferred to have a provider of the sex that you did not see, right? Any questions about that? Good deal. And again, when you start getting in the practice of asking questions and administering assessments, you'll be trained as to how to portray yourself whenever you're conducting assessments. All right, so let's go back to our slides. Another method is to use telephone interviews. Telephone interviews. Now, in this regard, we can do both interpersonal, so you're actually talking to the examiner, but we can also have automated, right? We can have automated means to the survey. Now, sure, it's going to help us save time, right? It's going to save time, and it's also going to allow for that reduction of that bias. But just like the mail survey method, less people are willing to participate. All right, so just like in the mail issue, we also have the same issue with telephone interviews because you're not in person, right? You're not there, so it's easier to say no, right? It's easier to say I'm not going to participate. Now, some people utilize what we call random digit dialing, which is basically we're going to generate, right, telephone numbers at random, right, to call at random, right? And that's trying to, if you remember from sampling in previous lectures, you'll recall that the more random a sample is, the more likely the more people are going to be selected, they're going to be representative from that population. So some individuals do use random digit dialing as a method to try and increase their chances of getting those participants. Now, if we go back to our slides, you notice that we also have interview surveys, right? Interview surveys. But this one's a little different. Why is that? Well, because we're going to have, first of all, focus group interviews. Focus group interviews. And the intent is to survey, right? It's focused, aimed into getting a group of people, right? A group of people to share their opinions, right? Share their ideas, their thoughts. So in this case, you know, until now, we've been talking a lot about that individual, right? That individual, that one guy, that one lady that I'm going to ask questions, right? And it's a very individual thing. Whereas here, I'm trying to look at a group of people at the same time. So maybe you are doing this, for example, here. I will be doing that here and asking you questions, right? Asking you questions about whatever the topic or whatever trait I'm trying to look into, right? So now I'm focused on a group of people. Now, it's structured in a fashion that generally we don't want to talk and interact with a group that it's more or less 3 to 8 people. In this particular regard, we want to limit it because remember, we're going to use open-ended questions. questions. And if you recall from earlier, open-ended questions are harder to interpret, right? Because they're open, there's many themes, they're not numeric, right? So they're a little harder to interpret. So of course, we don't want to have a million people answering, right? We want to be focused, right? We want to keep it aimed, targeted. Interestingly, in a focus group interview, your role more than an examiner is really that of a moderator. It's really that of a moderator. You're trying to find out what these true in-depth opinions are. That's why they're open-ended. So here you serve more as a moderator. Now, interestingly, when we are having these conversations, generally they will be recorded. They will be recorded. If you recall from one of your first exercises in lab, that's what you did. But instead of being a group, you did it on an individual basis, right? So if you notice, you're trying to record. What do you think we like to record whenever we're doing this type of interview? Who can tell me why we would prefer to record what happened, just like you guys did for your lab? You can tell. Yes, ma'am.
So you can review it later?
You could. It helps for the review. What else? Yes, ma'am.
You get what they're actually saying word for word.
To get that information verbatim. Also, to reduce my bias. Because I was there, right? I was there, I lived, I saw it, took pictures, went back home, right? So I was there. But I have bias. What doesn't have bias is a recorder. That is going to record word for word. And you might have seen it in real life. For example, an interview of a suspect, right? One detective can say, well, this sounds guilty to me. And another detective, I don't think that's admission of guilt. Right, so if we have a suspect and they are talking about, let's say, a crime, they can say, well, I feel sorry for the victim. Well, is that admission to the crime, or is that just an empathetic statement? Right, so that's why we like recording, because I, as the examiner, I also have bias in the interpretation. And of course, if they're being recorded, we need what? Informed consent, super, super strong informed consent. Hey, you're being recorded. This is what I'm going to do with your recording. This is how long I'm going to keep it. Don't worry about it. It's not going to be on TikTok. I'm like, yo, check this out, right? So, I mean, that'd be the last thing you post on TikTok. You're going to get sued, right? Last thing you post on TikTok. Any questions about those methods? Whether it be written or interviews. Good deal, fantastic. Let's go back to our slides. Now, there are difficulties, right? There are difficulties when we're conducting a survey, particularly with sampling, right? And also with non-response bias. So, first thing I want to talk about is a response rate. What is a response rate? That is simply the amount of people who agree. The response rate is yes, how many people did actually agree for your survey? So a couple years ago, I conducted a study and about 600 people agreed to participate, but only about 400 actually remained in the study, right? So that will be my response rate, right? The 400 something people. So that will be my response rate. How many people did actually want to stay in and stay, right? They remained in that assessment or that survey or that research. Now, there's generally some issues. For example, if we have a low rate, right? If we have a low rate, what that can tell me is that those responses only apply, they were only limited to people who were willing, right? And I like to think about that as people who are hyped for the study, right? So you find out Dr. Shar is doing this assessment, or you find out Dr. So-and-so is doing this assessment. It's like, ooh, I'm interested in that. I really want to do it. But then it turns out a lot of people didn't do it. So that's a problem, because for that researcher, that might mean there's only a very specific, select, particular group of people that is willing to do this, right? So now I'm not getting a general sample, right? Now I'm getting a very specific group of people, right? So that can be a problem. Now, generally, what we are shooting for, what we're aiming for, we're trying to get a high rate, right? So if 600 people agreed, I would hope that 600 people will stay, right? Why is that? Well, generally, more is better, right? More is better when it comes to statistics, particularly in this regard, because now we can be more confident. Now I can say, okay, I have a large group of people. That makes it more likely that my sample is representative from that big population, right? So for example, how many students do we have on campus? I'm not even sure. Does anybody know the actual number? 10,000 people. That's a whole lot of people. That's more than a lot of people in a zip code in half the towns around here, right? That's a lot of people, right? So if I have a sample and only 30 people decided to participate, these are the highly motivated, highly interested people. So it's small. Now my conclusions can only focus on that group. Whereas if out of 1,000 people, let's say I get 8,000, that's pretty good, because now that's going to be a little bit more representative of the population that I'm trying to examine. So for example, students on campus. Now, what is non-response bias? What is non-response bias? This happens when the participant chooses not to complete that survey. Or while completing the survey, they refuse to answer or respond to a specific item. Some people simply are not comfortable with continuing. Or some people would say, I'm going to answer all of your questions, but I'm not going to answer any about religion. Or I'm going to answer all your questions, but I'm not going to answer any questions about sexual trauma. So notice that the person can either completely say no and not participate, withdraw their participation, they started and then they left, or they can pick and select which ones they will or will not answer. Now, the situation with that is that now that response, that data set will likely be invalid, right? Because you're not answering all of the items. Now, ethics question, can a participant do that? If they say, all right, I signed the informed consent, let's do it. And they're like, you know what? I'm not feeling it. This is not what I want to do. I'm out. Who thinks they can't do that? Who thinks they can do that? All right, so the answer is yes, they can. Because this is voluntary, right? So they can withdraw from their participation. Consent can be removed at any time, right? So they can't. Generally, what we're shooting for, our objective, the gold standard, we would expect that at least we have 75%, right? We have 75% that was kept. But generally, this would be utopic, right? This would be perfect, right? That would be great. But generally, for peer review, what we tend to see is less than 50. So about less than 50 of the individuals who had agreed will remain. Now, there are some factors about the non-response bias. Is sure, if we have a small one, right? If we have a small rate, that could limit that validity, right? It might not necessarily be a problem to you because sometimes I'm not interested in generalizing results, right? Maybe for you, right, we have 10,000 people, right? We have 10,000 people here on campus. And I only got 30 people, and you're thinking, well, that sucks, because now you don't have a representative sample. Maybe I wasn't interested in a representative sample. Maybe I was only interested in, say, 30 people. Maybe I was only interested in 100 people. So for example, right, come the end of the semester, you have to leave your little reviews to good old Dr. Shar over here. I'm not interested in the opinion of 10,000 people. I am interested in your opinion. So it may be that not having that high response rate may not even be a problem, right? Because you're only looking for that specific group. Might not even be a problem after all, right? I'm not interested in generalizing how much people enjoy a class here and say students in engineering. There's no generalization there. I'm interested in your opinion, your thoughts, your recommendations, so that I can be a better instructor, right? So maybe I'm not interested in generalizing my results. Right. Now, something to recall, something to remember, if we go back to our slides, there are multiple aspects that we need to consider in order to remain ethical, right, when it comes to our research. We have to show respect, right? Have certain ethical responsibilities, both in how to handle and administer the surveys, right? It shouldn't be offensive. It shouldn't cause a level of distress for the people who are trying to answer your survey. Also, you should not coerce participants. Mostly because, first of all, it's unethical to coerce someone. And second of all, even if you do coerce them, like say, for example, remember back in the day when your parents would tell you, do this or this is going to happen? Sure, you did it, right? But was it really the intent? The intent was for your parent to see some level of respect, but were you really respecting them or were you fearing them, right? So when you coerce someone, are you really truly getting what you were hoping for, right? Don't harass people, right? Don't call them 50 times. Don't send them 50 emails, right? Nobody likes that, you know? Nobody likes that. Nobody likes that. Now, you are responsible ethically and legally to maintain confidentiality and anonymity, right? So anonymity being you have absolutely no idea identifying information for the person. And on confidentiality, we do have a mean to identify this person. Therefore, it also has to be difficult, right, for this information to be leaked. Any questions about that? All right, and that will be the end of the survey side for our lecture. Thank you.